Welcome to the Naturally Healthy Pets Podcast. Let's get to it. Welcome to the Naturally Healthy Pets Podcast. I'm your host, Dr. Judy Morgan, and my guest today is actually one of my favorite people. Dr. Barbara Royal is an integrative veterinarian, author, researcher, pet food and supplement formulator, international lecturer, and professor. Yet she doesn't sleep, I think. She treats pets, wildlife, and zoo animals and considers planet Earth to be her largest patient. In order to provide resources and education into the causes of health and longevity for her patients, she founded the Royal Treatment Veterinary Centers and the Royal Animal Health University, which now owns the Animal Diet Formulator, which is amazing, and College of Integrative Veterinary Therapies, great courses. She has devoted her career to improving the health span and lifespan of her many patients, their caregivers, as well as her colleagues in the veterinary profession. She shares time between her Chicago practices, the waters of Lake Michigan, and the soil of her organic farm. Thank you for being my guest today.
Yay, I love doing this. So fun.
So you have an organic farm?
I do. My husband's a farmer. So that's what he does. And so we have this weird life where we're constantly like, what we do is right outside where I can see right here in my driveway is actually full of vegetables and flowers that my neighbors just come and get.
That's so cool.
He brings a truckload of stuff and then I text them all and say, this is what's here. It's potatoes, it's sweet, peas and, whatever.
How big is your farm?
It's small. We're only farming about an acre of it.
Oh my
But
gosh.
he's just like, it's maybe 2 acres, but he gladiolas. Oh my gosh. Okay, there's some gladiolas from our farm. And they're so just pretty. Like, we have a field full of gladiolas. That's the coolest thing. And then you get your own, the potatoes that taste like, But it also makes a difference for us because we're obviously very dedicated to the idea of keeping the soil and, everything else healthy in the planet. So I'm very big on making sure that we're eating well, doing well. And that, goes from my pets all the way to my family and everything else. So it's a good combo.
It absolutely is. And it segues right into what we're talking about today. Is there a pet nutrition emergency? Which, yes. And we'll talk about why.
Let's just say yes right now, but yeah.
And insights from the I might be wrong method of veterinary care, which I think is amazing. I wish more veterinarians had the ability to say, I might be wrong, or I might need to think outside the box or look at this differently. Anyway, what is a pet nutrition health emergency?
Well, so I started, the book I wrote years and years ago, I started the book with a story.
Which is awesome, by the way.
Thank you. I loved writing it. It was super fun. But the worst part was my sister told me I had to write about the fact that I had a fire in my house and I lost 2 animals in the fire. And I was like, I'm never going to be able to write about that. It's not going to happen. And then I finally ended up doing it. And the reason I did it was not to make everyone sad or to scare everyone, but because it says something about us. To me, it's really an important thing to start the book with and to say, you have an emergency in your house. Your house is burning down and you're afraid and your animals are in there. And that's what happened. I came back and I knew they were in there and I did something that was so against common sense and wrong, right? I ran into the burning building, which I do not recommend anyone do because if it were not for the firefighters that were already in there, I would be dead. Because I went in and it was just black as night. I could barely breathe. There was heat and smoke and the floors were falling in. I mean, that kind of stuff, right? And I'm trying to find my pets because I'm just like, well, I'm a vet. I can do this. I can save them. I know that I can do this. And they carried me out of the building, right? But what it says to me is sort of 2 things is that, in an emergency, most of us will do almost anything for our pets. And in a really serious case of fear or whatever, we'll even go past our common sense and do things that maybe don't make sense. Right. And so those 2 things together have made sort of a marketing perfection for a lot of the bad actors out there. And I think that's what's happened to us. I mean, so I made a little list of the things that, that when we're motivated by fear, like fear of cardiac disease, made us all, not all of us, but a lot of people suddenly stopped feeding any foods that didn't have grain in them. And it's a complete fallacy, has nothing to do with reality. The research didn't even prove that, but everyone's like, I'm terrified of my dog having heart disease. So I'm going to feed, food that has grain in it somehow. And none of it makes sense. I won't even go into it because it's so crazy. But the fear factor pushed everyone over the edge. Fear of animals getting sick from leftovers. We stopped feeding fresh food altogether because people started to spread the fear that, oh, your leftovers are making your animals sick and these things are making, and it's like, really? And then, and in the same thing of bacteria, we're afraid of bacteria, but our common sense says bacteria is in fact everywhere. Like it's everywhere all in my hand right now. Like, I'm sorry, but it is. And we're afraid of it. So we feed a dead, ultra processed food to our pets because we're afraid of bacteria. And so I just look at all this stuff and I go, okay, that's one thing that we have to pay attention to and recognize and take a minute. When we're afraid of something, don't just knee jerk and fall into a trap that doesn't actually, if you think about it, it doesn't make sense. Right. And so that emergency is there. And then also knowing there's an emergency out there with your pets. It may not seem that they're dying. It may not seem that they're right on the edge or they're in a fire, but their hair coat's bad. They've got arthritis. They've got allergies. They've got cancer little growths. They've got bad teeth. They just look sort of miserable. And we're like, oh, they're just getting old. Like, that's an emergency. And we need to do something about it. And the fact is, what we can do about it is something that sometimes people think it's weird. We sort of go, it's too much. It's too much to think about food and an emergency. They don't make sense. Food seems so normal and pedestrian, and emergency seems so cool. Like not even cool, but I mean, like, you have an emergency and you're talking about it. And It's like, everybody likes to think about like, I solved an emergency. But food is the answer. And so there's an emergency out there, and the answer can be something as common sense as providing the causes of health, providing great food. And that's what I think.
Absolutely. And it's funny because I was just doing an interview about, chiropractic and physical therapy and all that kind of stuff. And she said something that is exactly your point, is we don't see the smoldering fire. We see the, oh my gosh, now everything's broken and now we want to do something about it. Mm-hmm. Whereas if we were proactive and we said, wow, how do I put out the smoldering fire? How do I get rid of the embers? And how do I prevent this from being the house burning down?
Right. And we're not taught, as veterinarians, we're not taught to think that way. We're taught about medicines and surgery and the things that treat disease that's there. We're not taught about the causes of health. And we're not taught to ever think we might be wrong. Right? So we're taught like, you're the doctor. You're finishing vet school and
I have a white coat. I know everything and you cannot question me.
Right. And so like one of my first cases was such a funny thing. It's a woman who had like 9 Newfoundlands, and she brought them in, and she brought in 3 of them at a time because obviously exam room size, right? So, but they were the most gorgeous dogs I'd ever seen. They were, the older ones, over 10 was glowing with health. The puppies were vibrant. They were perfect. Their teeth was great. I was like, wow, they're amazing. Like, you live out in the country. I got it. Oh, okay. Well, they're just really great health. I perfect bill of health. They're walking out the door, and she goes, oh, and Barbara, I just thought for the record, I don't feed any kibble foods. I have actually a separate kitchen for my dogs, and I make them a fresh food. And I was like, oh my gosh, Joan, get back in here. We've got to talk about this. This is terrible. You're going to kill your animals. I mean, and I am flying in the face of reality in front of me as a doctor, right? And all I'm thinking is, oh my God, I've got to get around one of these kibble foods that we sell here because I'm fresh out of school.
Yeah.
And it took me a while. Like, it took me at least a year. I started studying acupuncture, and I started to go, could the food have? Because she looked at me when I said that to her. She just looked at me and she goes, Barbara, we're never going to talk about nutrition again. And she walked out.
Well, good for her.
Right?
I was the same way when people first started. Same thing. Acupuncture was the thing. Like, I don't know where you studied acupuncture, but I went to Chi, mm-hmm. and in like the very first session, we're sitting there learning stuff, and we were learning kidney points, and somebody brought up prescription kibble, and they said, "Oh, you mean killer diet?" And I went, "Huh?" Mm-hmm. Like, mm-hmm. What do they mean by that? Mm-hmm. And that literally was the spark that sent me on the journey to where I am today. Was that one comment that somebody said, and I had been the prescription diet saleswoman of the year. Like, I sold more of this stuff because that was what we were taught was the best thing to do. And so after I started doing acupuncture, I had more holistic people coming to me, and they started asking me about feeding raw, and I use the old line, oh, bacteria. Oh no, we can't do that. And I think 6 months later was when I bought the first barf diet for my dogs and went, oh, isn't this cool?
Wow. All right. So yeah, I think that's the deal for me too. I just, it was like, you just sort of, suddenly you just go, I think I was wrong. Right. And if you can do that, the problem with it is everyone's so invested in being right as a doctor that it's very hard because we're afraid we're going to get sued. We're afraid. I don't want to say to somebody like, for the past 6 months, I've been recommending this, and now I think it's actually really toxic. Sorry. Or, yeah, we didn't need to do that. But now I've really embraced it. Like, I teach it to vet students. I teach this method when I'm lecturing to kids. They seem so confused. They're just like, what do you mean you might be wrong? You're the professor. And I'm like, not only the professor, I'm the doctor. And guess what? I don't know how often it happens. I feel like it's, maybe every day, maybe every week. I go, oh my God, I didn't think about that. Why are we feeding 3 times a day to an animal that normally would hunt and eat once a day or every other day? Why is that something that's helping us? Does it, and then you have to look at it critically. Like, I've been just doing it that way, but maybe I'm wrong. And then all of a sudden it changes how you think about nutrition. And it's the same thing with the kibble foods. I never looked at the ingredients because I just believed them. And then you look at the ingredients, you go, I think I might be wrong here. I
think I might be wrong. I think there are so many things, not just nutrition, but so many of the pesticides and chemicals and drugs that we're using for our animals that are touted to be the best of everything. Yes. And, you don't want to be that veterinarian who prescribed that chemical, and then the animal has this really horrible, deadly reaction. The last thing you want to do is go, oh, I might have been wrong. I might have killed your dog, right? Or I might have killed my own dog. That's a really hard position to be in. Nobody wants to be in that position. Mm-hmm. 1, the guilt is overwhelming. 2, the fear of being sued, the fear of being lambasted on social media. There are a lot of reasons why no one would want to say, oh, I might be wrong.
Particularly if you're fighting an industry that's so big. Yeah. So if you're going to say something that's outside of the norm. So right now, I don't know if I can talk about this without crying. So I'm going to try. But I had a client that came in not too long ago who wanted a monoclonal antibody injection. And I am not a big fan. And we went through a little dance about it. And he said, I'm just so concerned. She itches like mad. She looks terrible. And I hate to have her do this. And I already had it at my other vet because he was just a newer client and already had this a few times. And I really, really, really want it. And it was early days. It was, not too long. It's been a while now, but I still feel it right here. I was like, I haven't heard a lot of terrible things about it yet. It's, newer. It seems sort of, I guess, maybe, if you really want to do it. And he was absolutely adamant. And I knew not to do it, but I let him do it. And so we let him have it. And the dog was dead within 24 hours. And I loved her. I'm going to cry. Wow. Anyway, I loved her so much because I had only seen him 3 times. And she was this beautiful dog. So those kinds of things, now I have to say, don't do those things.
Yeah, exactly.
I was wrong. Exactly. I was wrong to let that happen. But it's like...
And there are a lot of times, though, when the clients are really adamant, no, I've done this before. I want to keep doing this. And we know it's wrong. And unfortunately, that one had a very sad ending. We need to take a break to hear from our sponsor. We'll let Barbara get a tissue. We'll be right back. I'm excited to tell you about Raised Right. Raised Right is a family-owned, human-grade pet food company that works with veterinarian Dr. Karen Becker to make gently cooked whole food recipes that are high in protein and low in carbohydrates. I feel good recommending Raised Right because their adult dog recipes are complete and balanced through using only whole foods without having to add any synthetic vitamins or minerals. And most of their recipes have less than 2% carbs. That and their recipes are so simple, many having only 10 ingredients or less. My own dogs and cats absolutely love Raised Right. Order yours today by going to raisedrightpets.com/Dr. Judy. That's spelled out raisedrightpets.com/DRJUDY. Raised Right is raising the bar on high quality, whole food nutrition for your pets.
Do you want to prepare complete and balanced meals at home for your dog with confidence? Let Dr. Judy take the guesswork out of home prepared food in our Homemade Food for Dogs 101 course. Once you purchase this fun and easy to understand course, you will have permanent access and can re-watch at any time. Take advantage of a 15% discount where Dr. Judy helps you feel comfortable making safe and balanced meals for your dog using fresh whole foods. Use code PODCAST51 when purchasing on drjudyu.com. Your dog will thank you.
Welcome back. You're listening to the Naturally Healthy Pets podcast. I'm your host, Dr. Judy Morgan, and my guest today, Dr. Barbara Royal, I think is one of the most amazing veterinarians ever to walk this planet.
Wow.
You care so much, obviously, by your story. And you not only care about your patients, but you also care about the humans on the other end of the leash. You care about the planet. You care about the educational part. And I mean, it's something that if we could all kind of come at what we're doing as veterinarians with that mindset,
Mm-hmm.
we would all be so much better off. And I think we would preserve our own sanity a lot more as well, because, the definition of insanity is doing the same thing over and over and expecting a different result. And I think as veterinarians, when we keep prescribing prescription diets and kibble that's dead food, and then treating with steroids and non-steroidal anti-inflammatories and monoclonal antibodies and all these things to put out the fire of inflammation in our pets, and we expect them to get better when we haven't changed the groundwork to help them heal. No wonder veterinarians are frustrated. No wonder clients are frustrated. No wonder everybody's quitting.
Well, and I do feel like we're just such a unique profession, right? So people who are veterinarians, they wanted to be a veterinarian since they were 6, right? And what that meant to me, what it meant to me was when I figured when I came out of vet school, I was going to be almost like a superhero to myself. Like that's who I envisioned. Like I wanted to be James Herriot. I could handle anything. Like it seems crazy. No, I got that. And to have it like when I'm out practicing, somebody put oven mitts on my hands and somebody gave me sort of half vision glasses, and now I'm supposed to function and do good. You feel frustrated and sad, but also to your core. It's not like, I'm sure people who are bankers are happy being bankers, but maybe they didn't want to be a banker since they were 6. You know what I mean? So I think it's soul killing to feel like you're not making any headway towards health because everything we're doing in just the background really, it's degrading health. And that's a problem.
Yep.
And so the nutrition part of it though has been, it's absolutely it, but it has sort of, for me, it just sort of trampolined me into the next thing and the next thing, it's grooming products and what are we using to brush with? And then what's happening with teeth and why are we not letting them chew on fresh raw bones? And why are all these other things happening? And I just look at all of it and I go, I have to go back to common sense and say, oh, I might be wrong there too. Might be wrong.
Yes. What about that? Here, these are the prescription shampoos that we should be using. And then we look at the list of chemicals on those. They read very similar to the list of chemicals on the processed food. It's like, and then we just throw more drugs at them to kill the microbiome on the skin, in the gut, and we take away their immune system and go, okay, now get better.
You can do this. Yeah. We've just basically made you into a 2-dimensional little beast. Good luck with that. It's awful. And so I do feel like, people say, oh, we'll get, when my dog gets older, I'll get a little more careful with the food, but I won't do it when they're young. I'm like, they're building their bodies, they're building their immune system. We have to think about it throughout, even if you don't see a huge change in it. Like when I was 20, I used to be able to eat, 3 Musketeers bars and Wheat Thins, and I was fine. But, you can do that.
I would hate to tell you what my diet was
talk about it.
Vet school. Oh my gosh.
We should know better. As practitioners, we in the health profession should know better. And we don't.
But again, nobody ever talked about food.
No.
What we were taught nutrition wise, I mean, and I've been out 40 years, so I am a dinosaur, but what we were taught in our internal medicine class was, okay, for kidney failure, you feed this prescription diet.
Right.
There was no talk about fresh food. It was all, oh, you've got to restrict protein really early on. And now we know that restricting protein actually kills them, which by the way, that myth is still flying around out there.
Strongly.
It's still strongly there. Oh, you need, and I'm like, really? You're going to take your 12-year-old dog who's muscle wasted and feed them a 9% protein diet because their SDMA is 15 instead of 14? Like, OMG. And
as a doctor, we should know better. I can understand people listening to social media. You don't really know better. You're trying your best. It's animals. They seem weird. It's scary. It's like, is this a balanced diet or is this not? It seems really scary. Like, how do I know? I better go with the big companies because they're going to know the best. It's like, really? Do they really have your best interests at heart? Are we thinking with common sense here? And that's a problem. Yeah. But yeah, we're crazy.
You know what? I just read an article and, oh God, we posted it. Something about the pharmaceutical industry spends 68% of their money on advertising and like 6% on R&D. And it's like, wow.
I did not know that.
And yeah, I forget. I don't have the statistic exactly right, but
it makes sense.
It makes sense. And, so this is the same thing we see with food companies. Like their money is spent on advertising. It's not spent on the ingredients that are going into the products. I almost feel like if you're not seeing expensive advertising on TV for a pet food company, they're probably doing a better job.
Right. I tend to agree with that. Also, I feel like one of the things that we do is like we are paying attention to what we're measuring. So what they're going to be doing is spending a lot of their time measuring how much money they're getting in, whether the marketing's working, whatever. They're not measuring how well does this food, work in an animal? How much health is that food providing for animals? What's happening to the longevity of the animals that are eating their food? Are they coming down with different problems? They don't want to measure that because you don't really want to see that. Because then that means you're going to have to make a food that's more expensive to make. You're going to have to pay attention to the ingredients and the sourcing. And sourcing matters. People are like, oh, it doesn't, no. I get the cheapest thing from the supermarket because it's a dog. Like that would be okay 60 years ago because we didn't add all of the things we add now to foods to make them, red. They're adding food coloring to make a meat look red. They're adding all these things. It's like the things that are out there now that are cheaper have way more chemicals in them. And that's a problem for us.
Oh, yeah. Well, and nutrient density in the food that we're growing now, based on our soil erosion and nutrient depletion in the soil. I mean, it's impossible, which is why doing something like your farm and what I'm doing with my farm is what we need to do if we want to get actual nutrients in our food. So what are some of your favorite shortcuts for health through nutrition? What can people do? So let's say, okay, I've got 5 big dogs. I'm feeding this, what I consider to be a good quality kibble because that's what I can afford. The biggest pushback I get from people is it's going to cost too much. It's going to be time consuming. I've done lots of videos to prove that it doesn't have to cost more, but what do you tell people?
2 things. One is I try to change the conversation altogether. I just say, how first of all, how can it be that cheap? You've got 3 big dogs. You're feeding carnivores. How can it cost you very, very little to feed them? Because feeding them is the most important health decision you're making. And I would rather have you spend it on food than on a veterinarian. So I try really hard to just start that seed in the head. It doesn't help the situation in terms of finances that, in a straightforward way. But if people are thinking that way, then they start to realize where they're putting their money, in what bin. And then I try to also say, if it's going to be that cheap, then somebody in that company that's selling you something for really cheap they're going to be either cheating or subverting something in some way. It's going to happen. And so the problem with that is either they're paying their workers badly, or the animals are going to suffer somehow, or they're going to do additives and chemicals that don't make any sense to the food, or they're not formulating well. Something is wrong with that food. Mm-hmm. So you're spending money out of your important, like I work hard for my money. I want my money to go to somebody who's doing the right thing for the right reasons. Why not? We should be voting with our money. And so I try to get people thinking that way, like, don't give your money to people who are doing the wrong thing for the wrong reasons every day for your pet. It's just a bad idea. And most of it's just wasted. You may as well just throw it out the window. And 50 cents on every dollar that you're spending on this cheap food is really in garbage and bad stuff. So I try to do that. Then the next thing is say, okay, you have big dogs and you really have a limited budget, but you do buy food, and leftovers are great. People forget leftovers are amazing. So, when you have leftovers, don't throw them away. Don't have whatever. Just give them to your animals. And if there's something that's appropriate for a dog, great. If you're eating Twinkies and, Cheetos all the time, maybe don't. But that might encourage you to eat better too. Like eat a little bit better food, and give your, meat leftovers and things like that in a reasonable amount, so you don't end up making them, sick with suddenly a huge amount of leftover fat cuttings from a steak or something. But leftovers are amazing. And then there's also foods you can just buy that you can get periodically on sale or whatever. Eggs, sardines, different vegetables like, broccoli, green beans, things like that you can sort of just throw in. Even lettuces and kale, things like that. I love mushrooms.
Yeah, we started having chickens originally for the dogs. We got 6 chickens because I said I want fresh eggs for my dogs so that I can add that fresh food to their bowl. And so now our flock is up to like 30, and we supply eggs for our employees and us and our pets, and like everybody's eating eggs. So, there are so many things that you can do. I read a study, I think it was a town in Belgium, where every family in the city was given 2 or 3 chickens, and it eliminated all of the kitchen waste scraps, because that's where all of our kitchen waste goes. It goes to the chickens. Right. And so it lowered the garbage pickup in the city by a huge amount, and everybody had fresh eggs, and it ended up being like this great experiment. For everybody, it's like everybody loved it, and the chickens were great pets. And so, there are so many little things that we can do. I'm not saying everybody has to have chickens, but for us, it made a huge difference to the point where we keep multiplying the flock.
And for us, it's really nice to be able to add in these leftovers and add in things. And if you have, like, for example, I have the animal diet formulator, which we talked about. I can actually tell my clients, they're like, okay, well, we eat these kinds of things. Give me a list of the things that you might have leftovers in. And then I can put that in the animal diet formulator. I can say where that might unbalance or balance better a kibble food or whatever, because I have all of that information in the formulary. And so when we're looking in there, we're looking at these ingredients, I can tell them you have this much leeway with this much of your fresh vegetables, your fresh foods, even some starches, even some things. You can play with those and still have a balanced diet and keep them healthier because there's fresh stuff in there. So and now I have clients that have the animal diet formulator because it's inexpensive for an individual to own. So I'm not doing it as a marketing thing as much as like we get so scared about, oh, should we be doing this? Is it ruining everything? Whatever. No, it adds good. And we can figure that out too. So anyway, it can be amazing.
Yeah. Well, and studies have shown that it was a study done in Europe, but 90% of the canned foods made by the big pet food companies that they tested were not up to AAFCO standards, and 60-some% of the kibble foods did not meet AAFCO minimum standards. So if you think that by buying pet food from a highly processed food from a big pet food company means that you're guaranteed to get a complete and balanced diet according to AAFCO standards,
you're wrong.
No, it does not work that way.
And it's the same with the bacteria.
Yeah. And if your veterinarian says, oh, you can't give him table scraps, it'll unbalance his food, forget it. It's a myth. It's a lie.
And you can balance around, like, again, if you're changing things up. I'm a big believer in saying, okay, it's okay. We can balance by doing some variety. I do feel we should know that as veterinarians, I should know, like, I should be like, oh, you know what? I can tell from what you're doing. You're not going to have a source of iodine in here. And that's going to be a problem for you.
Right.
So I should be able to help, but people can look at it, but changing up what you do, where you get your food from, all of that's amazing. And if you think that fresh food is dangerous because of bacteria, look at all the recalls for ultra-processed kibble food for resistant and scary bacteria. Like, that's not safe. Yep. You can't put your kid's hand in a bunch of kibble and let them throw it to the dog and not wash their hands. That's crazy tunes. So, there's a lot out there that we, again, fear, the emergency, we have to pay attention, but we can certainly do better. We can certainly do better with the causes of health and nutrition.
Absolutely. Barbara, we are out of time. Thank you so much for your time today. We always have so much fun, and I think we could sit here for 8 hours. We will be seeing each other soon. For anybody who is interested in more information, Barbara has like a million things, but there's Royal Vet, the Animal Diet Formulator, and CIVT, which is the educational platform, some really cool courses for veterinarians and pet owners. We'll put all the links in the show notes. Barbara, thank you very much. Keep on keeping on. You're doing a great job out there.
More power to us.
Thanks for listening to another great Naturally Healthy Pets episode. Be sure to check out the show notes for some helpful links. And if you enjoy the show, please be sure to follow and listen for free on your favorite podcast app. We value your feedback and would love to hear from you on how we're doing. Visit drjudymorgan.com for healthy product recommendations, comprehensive courses, upcoming events, and other fantastic resources. Until next time, keep giving your pet the vibrant life they deserve.
The purpose of this podcast is to educate and to inform. It is no substitute for professional care by a veterinarian, licensed nutritionist, or other qualified professional. You're encouraged to do your own research and should not rely on this information as professional medical advice, diagnosis, or treatment. Dr. Judy and her guests express their own views, experience, and conclusions. Dr. Judy Morgan's Naturally Healthy Pets neither endorses or opposes any particular view discussed here.